Hi, I'm Kevin Wilk with Champion Sports Medicine in Birmingham, Alabama. And one thing that we see in sports medicine today in a growing occurrence of injuries are UCL injuries or Tommy John injuries to the elbow. This is an elbow model here. This is the front of the elbow. And you can see how it bends. This would be the inner portion of the elbow, and this is the UCL ligament made up of three components. This is the one aspect of the ligament that gets reconstructed when people injure their UCL. The UCL stands for ulnar collateral ligament of the elbow, and one of the reasons we're seeing so many increases is because of people involvement in overhead sports such as baseball and volleyball and javelin throwing and even water polo. UCL injuries are so common that on a professional baseball team, about 25% of all the pitchers have had Tommy John surgery. But the alarming fact is that we're seeing more and more young people with ulnar collateral ligament injuries and Tommy John surgeries. So one of the things that we're doing here at Champion Sports Medicine, as well as Select Medical and NovaCare Sports Medicine, is try to develop programs to prevent these Tommy John injuries from occurring. So looking at risk factors, we hope that we can reduce the incidence of this. In youth baseball players, the number one risk factor is pitching when fatigued. You've got a 36 times greater risk of sustaining an injury to the elbow when you pitch fatigued. Second most common reason is not getting enough rest. So exceeding the pitch count during the week, or playing multiple games during the week, or playing on multiple teams, or the season is extended. The third most common reason is specialization, playing only one sport, or only being a pitcher. So it's important for these young people to play multiple sports to rest their arm in the off season. Other reasons for youth baseball injuries of the elbow is throwing a weighted ball excessively in training, poor training techniques, poor biomechanics of throwing or pitching mechanics, and lastly, long toss. In the elite throwers, such as a professional pitcher, the most common reason for injury is velocity. Throwing at peak velocity, a lot of pitches. Second most common reason is pitch count, followed by poor mechanics, and also playing excessively during the course of the year. So we feel as though if we can control these risk factors, we can reduce the incidence of Tommy John surgeries.